The fundamental premise of primary health care is a whole-of-society approach to effectively organize and strengthen national health systems to bring service for health and well-being closer to communities, which are very often neglected because they are far away from the seat of government that is charged with the responsibility of providing basic amenities for them. This is the story of several communities in Nigeria's Federal Capital Territory with no basic amenities. Presently, most of the primary health care facilities in FCT lack the capacity to provide essential health care services, in addition to having issues such as poor staffing, inadequate equipment, poor distribution of health workers, poor quality of health care services, poor condition of infrastructure, and lack of essential drugs, and many more. This is Gosa community in Gui ward of Amak FCT, a community that has been totally neglected by the government in terms of provision of basic primary health care.
Even before the Biafra, even the First World War, the Gosa was existed. Gosa is developing, but there are some challenges that we are facing, especially in the social amenities.
Gosa community, located between Lugbe and Gwagwalada in the outskirts of Abuja, the Nigerian capital, has been in existence for the past 71 years, and in all of those years, nothing has changed. Most people here have resorted to self-medication at their peril, and young men in the community have taken to drugs and other dangerous lifestyles. The only healthcare facility in Gosa is a public health intervention facility donated and maintained by an NGO with no support from the government.
Yes, the major problem is that some of them do complain we don't give, that as in we don't have accurate equipment, what is supposed to be needed. But the one we have, this is what we are managing. Like services, maybe we're supposed to have maybe scanning machine at least, so that the government, or we have somebody that will be taking care of this pregnant mother, because they are the most important people in the community. So without them, the community will not grow the way it's supposed to grow. So we having that scanning machine, it will generate the community, it will make the community members to come here in order to make this place to be a center to them. But some of them do go different facility because we are lacking of scanning machine here. But if in time of service, we do our best to give them the needed thing that is supposed to.
However, on record, this health facility exists in the name of a government-owned establishment, but in reality, it does not exist. Gosa community is under Gui ward and throughout its existence has never been recognized to merit government support. Gosa still has no health care, no schools, and more people have died while trying to access health care in the neighboring towns. Even the borehole in the village was sunk by a non-governmental organization.
That means that you did not go there now and you begin to ask us and we tell you the government will think that we are against them, and which we are not against them. And I know that here, there is nothing working here at all. Are you getting me? Even the staffs that are there, I don't know their qualification. Are you getting me? I don't know their qualification. And even the head that is there is not helping matter. The facility, the primary health care that is here is here to help us with community. We don't have much, but if you go there, the kind of bill that they will give you, without even give you proper treatment, you'll be surprised. And these facilities are here. This healthcare, this primary healthcare is here to help us. Actually, we are solicited that government should come to our aid. They should come and help us and put facilities. The other day, they rushed somebody, one of our brother here. They were not able to attend to him. Severally like that. We will be going to Kuje, and before you take somebody here to Kuje, many children have died here. Even in the time of childbearing, we have lost so many women in this place because there are no facilities. So please, we are pleading with government. We are not fighting them, because I know when it comes to election, we do help them. In fact, here is the center of Gui Ward in terms of election. Because if you talk about election, we come in mass and vote for them. So at least we should enjoy the dividends of democracy. So please, we are pleading with government that they should come and put the necessary facility that we ourselves, at least, if you cannot give us if you cannot give us food, you should be able. We should have access to the health facility. If you cannot give us light, at least we should have access to that, because these are the social amenity.
The indigents and foreign residents have lamented severally about their predicament, but to no avail.
We are suffering for so many things. No, it's not good for me to have a father. At the end of the day, my father is not doing anything to me. That is what is happening in this our maternity. So it has been a slap to the community. And we are giving you a critical message to the government, especially the INMANEWS as a whole. In terms of election, according to what my brother said, we normally give ourselves massively vote for them. If you go there, you count the vote, we discover Gosa here, living in Gui Ward. We are the massive people that normally give them massive vote. They need to do something. Please and please, we are begging them in the name of God, they should come and help us so that we'll be able to know that, yes, we are also part of them.
This situation begs for answers to questions like, why are there no healthcare facilities in the community? Who is to provide the healthcare facilities? Is the FCTA aware of this issue?
Gosa is a deprived community. Their access is very low. The availability of health services is very, very low. And then when we try to establish the community managerial structure for Gosa that will link them up with the Air Force hospital as a referral center, the community had to take responsibility. Because what is the population of Gosa? What is the nearest private healthcare facility to Gosa? How can the people meet up with that? The population of Gosa is increasing now. When we came there were very few people there, but now it has increased. The primary school is there. We have some other, but people are living right inside, So the minimum service package that was done around 2019 or thereabout has to be reviewed and updated for those communities that the population has expanded to have at least a health clinic, and the staffing should also be optimized to meet the minimum requirement. Don't build a facility where you don't have staff. Don't build a facility we cannot equip to minimum standard. It doesn't make sense. Don't build a facility where the community are not involved, so that they can take ownership, set up the community managerial structure, set up the community management system, so that they can ask questions. The in charge of the private care facility is a servant leader that is going to liaise with the community and tell them the truth. The local diseases must be known by him, and he has to educate the people about that. But in this situation, these people take over the community and oppress them instead of telling them what they can do. So the people are suffering double problems.
With a population of over 200 residents, Gosa community, which is home to over 2,000 people and counting, still has none. This is by all means a failure on the part of government, which is yet to provide essential healthcare services to reach the vulnerable population in Gui Ward.
We don't have that power. So that is the challenge. You can see inside there, we are doing the immunization, which is supposed to be outside, so that everybody should receive the fresh air, but there is no way. We are using that place now. Instead of we attending to the patient, but we are attending to the immunization people there, which is supposed to be here. So that is the major problem we have. Yes.
What currently exists as a healthcare facility for these residents lack basic materials, equipment, and reagents in the test laboratory to enable them properly diagnose ailments for patients who take the risk of patronizing the facility.
I'm here for antenatal. Actually, the clinic, the nurses, they are actually trying. They are trying their best. They are very good at taking care of the patients. Their patient, they attend to us very well. And then our challenges here is that if government can help us to provide more care for the antenatal patients, I think that would be very, very fine. I think it would be a helping hand for them. This morning there was no enough chair when people came for the antenatal. Some were standing, some were just going about. It was tiring, but the nurses are actually trying, and they are trying their best. They struggle to do a lot of things on their own. They struggle. Some of them, they improvise. They struggle to do a lot of things, which if the government comes in, it will be more lesser for them. The work will not be hectic for them. I think they struggle to do a lot of things on their own.
So God has been helping us a lot. I know many people that register for antenatal here. After everything, God perfect the work.
Many people are come here, but we need more personnel. More personnel. And more equipment.
What could be done to remedy this situation in this community? And is the government even ready to come to the aid of these people?
But I'm happy because the engagement we have had with the ministry and the agency, the agency, the granulation of the system to the community is about to happen. That is where the community managerial structure for health should be activated, should be put in place, because the guidelines are there. Everything is there. So it's for us to do that, and the autonomy that has been awarded to the local government by the Supreme Court is, in fact, it shouldn't be something that we are looking at as if it's an invention. It has been there. So why do we wait for all these things to be pushed to us before we start doing them? So the local government now cannot tell us that they will not take responsibility.
Yeah, actually, they have been crying because the equipment that are in that primary health center, they are not enough. They are not some. They are not okay. They are manageable. And imagine, especially in the lab section, there needs some equipment for the lab, so that if you are coming for the test, there are some equipment that they don't have, and we appeal to the government to bring all those things that to reduce the expenses of the transport to general hospital.
It is the expectation of residents here that the government will swing into action and establish a primary health care facility for this community, as it will go a long way to alleviate the health challenges in this community through the promotion of food supply and proper nutrition, maternal and child health care, family planning, first aid and immunization against the major infectious diseases.